Hello and welcome to today's episode of the Pediatric Consult. I'm Dr. Paul Bunch, a community pediatrician in the Cincinnati area and your host for today. Today we have a little bit different episode. Rather than talking about a clinical condition, we're going to be talking about opportunities for education and furthering your expertise in different areas through something called Project Echo. Today's guest is Dr. Parul Bawa. She is a pediatrician at Springdale Mason Pediatrics and a multiple-time graduate of Project Echo. So welcome, Parul. Thanks for joining us today.
Well, thank you for having me. I'm excited to do this.
Good. To start out, just to let our listeners get to know you a little bit, can you tell us a little bit about your background, about your training, what brought you to Cincinnati, any outside interests?
Sure. So I actually, I've been doing this. I've been in practice for 25 years. So I went to medical school at Johns Hopkins, and then I did my residency in Chicago through Northwestern's program. It was Children's Memorial Hospital then. Now it's Lurie Children's. It's been renamed, and it's moved. And I worked for 3 years in private practice in Chicago, and then my husband got an opportunity to come to Cincinnati, and we have family in Ohio, so we really wanted to come back closer to family, and that brought me to Cincinnati, and I've been here ever since.
Okay, and how about outside the office? Any special interests?
Yes, this is my time of year. I love college football. I actually love football, which is a sort of a conflicted love for me because of the head injury aspect, but I just really, really enjoy the sport and love these weekends where I can just keep track of college football and professional football over the weekends.
And at the risk of alienating some of our listeners, any particular favorite teams?
Well, I am a diehard Buckeye.
All right. Well, we won't hold that against you too much here in Cincinnati. Let's see. So today is about Project Echo. And if we could start out by you just kind of describing what is Project Echo.
So Project Echo is a system where I think the goal is to link subspecialists with community providers in a way where they can teach several providers at one time and therefore enhance the provider's ability to manage medical situations. And then also there's an opportunity for providers to ask the expert their opinion on things. So it's kind of like, I guess I would say, fancy CME because it's case-based and it's done via Zoom. And the idea behind that, I think, is that you can just reach so many more people. But it's like they have the same group of providers that do a session for, say, 10 weeks. So you end up getting to know the other fellow providers, and it creates a nice community.
And over the course of 8 to 10 weeks, how many different sessions are there?
So most of the ones I've done, they meet once a month. I did one session that was twice a month, and I have to say that got to be a little bit too much. But once a month is a nice cadence.
Okay. And how did you learn about Project Echo?
I think I got an email. I think it was in an email from Cincinnati Children's. I'm trying to remember back because it was a while ago. Okay. But the first one that I did was for hypertension and hypertension management. And I remember when I got that email, and I thought, okay, that's clearly an area where I don't feel like I'm very strong. So that's what drew me to sign up for it.
Wonderful. And once you sign up for it, is there any cost associated with Project Echo? Any other commitments that you need to make? No,
it's free. That's kind of one of the coolest things. I feel like I started this. It was maybe right before COVID, and then started through COVID. But it's wonderful because it is free. You sign up. If you miss a session, it's okay. But you find that you don't want to miss them because they are so helpful.
And you mentioned that it's 1 to maybe 2 times a month. Mm-hmm. Is there a consistent time of day? And how does that work with your very busy clinic schedule?
So the once a month, I think, is much more doable. And they've offered them at different times. Like some are offered at like 7 a.m., some are offered in the evenings, like around 6 or 6:30. And then there was a lunchtime one that I've seen them do as well. I think worked well in my schedule. I've been lucky that most of them have fallen on my day off or like a morning that I'm off, so I've been able to do it. But I think the 7 a.m. also works because you can get that in before your clinic starts.
Okay. And then you mentioned that you're with a cohort. You're with a consistent group over the scope of it. How does that cohort work as far as like level of interaction and working together?
So the one thing that has been really nice is that some of the people they're not all Cincinnati people. So you've got a lot of providers, primary care providers around Cincinnati, which is nice because you kind of get to see your colleagues. But then I've been on calls with some people from Tennessee and people from Cleveland and Atlanta. And there's always a case presentation. So one of the primary care people will present a case, and then there's an opportunity for the other primary care providers on the call to ask questions. So that's where a lot of the interaction occurs, where you're asking questions and learning more about the patient. And then what they'll do is they'll leave time at the end for the hub team. They call it the hub team, which is basically the specialists that are on the call. So for like the psychiatric ones, there'll be a child psychiatrist. There's usually a psychologist, sometimes a social worker. And then they'll leave time for those people to then chime in on their thoughts about the case and what they think could be ways to go forward. And
do you ever like take the advice that they give you on that particular case and take it to the patient, or do you feel like it's usually kind of it's too late for that and you just apply it to future patients? Or I guess I should ask, have you ever had an active, difficult case that you've brought to Echo and gotten benefit from?
Yes, that is probably one of the primary benefits for me. I mean, that's been one of the main benefits. I've had at least 3 or 4 cases where I've been able to present kids who really just I'm not quite sure what to do with, or I don't know what the best step forward is. And what they'll do is when you present it, you hear from other community providers, and then you hear from their team on their advice. And there's somebody typing that whole thing up while we're talking, and then they'll email it to you. So I can think of like 3 or 4 patients where I have been able to get really good advice on medical management, or like what the best next step is to give them advice, or just thoughts on other things that might be going on that I hadn't thought of.
So some real-time consultation and improvement.
Definitely. Awesome. And in those cases, I've gone back to the patient, and I'll say I usually say I'm taking a seminar course because to explain Echo is a little bit more than is necessary. And I find too that the patients welcome knowing that I'm talking about their case to others and trying to get a better idea of what to do. So I found it's been quite well received.
So can you talk a little bit about the different Echo cohorts that you've been part of? You mentioned hypertension. What other ones have you taken part in?
I've done hypertension, anxiety, depression, autism, and then I'm doing the graduate series. They call it the graduate series for psychiatric issues. So that's psychopharmacology.
Okay. And how have these kind of impacted your clinical practice since you've done them? Like, have you noticed changes in ways you approach things, or treatment modalities you're more comfortable with?
Yes, I would say definitely. Like with hypertension, I feel there were a lot of basics that I just didn't have a good understanding of, in terms of what machines are good to use and how do you track a child's blood pressure, and not having them necessarily just do it at home with any old automated blood pressure cuff, that stuff like that, and just that really good information even on ways to train staff in your office to take blood pressures on kids that'll be more accurate. So that was great. With hypertension, was very helpful. Also going through the management, and then with psychiatry, it's been really, really valuable because right now the psychopharmacology is talking about drug interactions. What do you do if you have a patient who you've tried these meds on and you don't know where to go next? So a lot of it is very much geared towards the dilemmas that primary care providers face when they're trying to manage a psych patient, and understanding that it is very difficult to get people into psychiatry.
And you've also done the autism Echo cohort. Any pearls that you took from that experience or changes in your practice?
Yes, that was a really helpful echo class for me because one of the experts they had on that call was a parent. So we were able to get the parent perspective on some of these cases, and I also got a lot of good resources. So that was very helpful because they had social workers on, and a lot of the issues that we have, I think, with autism sometimes is just how do you get kids tested, what are good places to go for testing, and so that was great to get some really good, solid resource lists, and then also getting a better idea of ABA versus play therapy. So that was a situation where I actually had a patient who came in and said, I don't know if I want to do ABA, but I've heard about this play therapy. What do you think? And I thought, I don't know, but luckily I'm taking this class. And so in that case, what happened was I wanted to ask that question in one of our sessions, and I think we ran out of time. But if you send a text, it's like a Zoom call essentially. Yeah. So if you send not a text, but if you send like a chat question, and they don't have time to answer it, they will still look at all of those questions and make sure somebody gets back to you. And so one of the psychologists was great. I mean, she said, why don't I set up a quick call with you and we'll talk it through, which was amazing. Yeah. And she was able, I learned a great deal about contrasting the two and what's maybe more effective for what age group.
Yeah. Have you been able to continue relationships with your cohort preceptors, to have that person you can reach out to and
yes.
contact about difficult cases or questions that you have?
I'm always amazed and pleasantly surprised that they're willing to give us their email. And so I try not to abuse it, but it's been wonderful because like Emily Harris has been just an amazing specialist on these calls. And she is so willing to be available, and you can reach out to her at any point and just say, hey, I'm not sure what to do with this kid, or how do you think I should manage this kid? And she is, I don't really know when she sleeps or does things because she's always available.
She's pretty fantastic to work with, I would agree. Any barriers to, potential participants, things that, you think would make it more challenging to participate in Project Echo?
I think timing is probably the biggest one. Obviously, it's free, so that's very nice. But you do have to put aside a good hour and a half for it. So that can be a barrier. If you're trying to squeeze it in like a lunchtime, I think that's really challenging.
Our lunches are variable on how long they actually
Sometimes
last.
They're like 10 minutes, yeah. So that can be difficult. I have been fortunate in that I've only signed up for ones that are on my day off or are occurring at a time when I'm not in the office.
Okay.
I think if I was trying to do it from the office, it'd be difficult.
Okay. You mentioned that you're taking the graduate level Project Echo on the psychiatry topics about psychopharmacology. What allows you to be able to get to that level? Are there any prerequisites? Do you have to do the basic courses first, or a certain number of basic courses?
I think they strongly recommend that you do the anxiety echo and the depression echo first. And part of the reason for that is those initial echo classes go through more of the basic management, and then the graduate level sort of builds on that. So in the first series, they're going to be emphasizing, what are the best medications to use, and how would you pick which one to use for anxiety or for depression, and side effects and pitfalls and all that kind of stuff. And then when you go to the graduate level, then they're focusing more on medication interactions. How do you cross taper? So kind of the next level of management. So it is helpful. They're all taught by the same person. So it is helpful to have had the first two or the first couple before you go on to the graduate level, because their curriculum sort of builds on itself.
Well, thank you, Parul. That was all really helpful to learn more about Project Echo, your experiences, some of the benefits that you've gained. Is there anything else you think our listeners would like to know about Project Echo?
There are a couple other really important benefits. So the way the ECHO classes have been coordinated has been wonderful, and I have to give a shout out to the coordinators because they are really good about sending emails to remind you. You get text messages reminding you, so they do their best to kind of keep you keep you updated and make sure you don't forget, because it is once a month. You also get MOC credit, which is really nice.
Okay.
So CME and MOC. And then the other thing that I've really liked about these classes is their presentation, like they do so we talked about how it's case-based, right? But there's also a didactic portion, and that's where they'll kind of just go through some principles like drug interactions or how do you interpret gene site tests, things like that. And the didactic is usually a PowerPoint, which they will send out after the talk.
Okay.
So that has been great because I've saved those and actually found them really useful when I'm teaching in the office, when I'm teaching residents or working with my continuity resident. It's a really nice PowerPoint to be able to fall back on and use as a way to teach.
That's fantastic. Well, if you want to learn more about Project Echo, we'll have the website linked in the show notes. It's cincychildrensecho.com, and that's Cincy with a Y. Upcoming Echo cohorts, there is one called Act Early that is all about early childhood development. There are cohorts on anxiety and autism spectrum disorder for the primary care provider. Also, there's several Project Echo cohorts aimed at therapists, one on autism, one on mental health and behavioral treatment geared for the therapist. There are also Project Echo cohorts coming up on depression, and neonatal abstinence syndrome, and trauma and the impact on children's mental and physical health. So lots of opportunities to expand your practice. Refer to the show notes again, and we'll get you right to that cincychildrensecho.com website. Once again, thank you, Dr. Parul Bawa, for your time and experience. I hope everyone has a great rest of their day.
Thank you.